Hello, my name is Sabrina Reynolds.
And my name is Ella Campbell.
Hi, my name is Isabel Springer.
Today we're going to be talking about tularemia and cat scratch fever, and we're group 16B.
Our pathogen project is based on tularemia and cat scratch fever. Tularemia is a bacterial infection caused by the organism Francisella tularensis. It infects both humans and animals, making it a zoonotic disease. The causative agent, Francisella tularensis, belongs to the family Francisella There are several subspecies of F. tularensis. The first F. tularensis subspecies is F. tularensis, which is a type A, and it's most virulent, found mainly in North America. The other subspecies of F. tularensis is F. tularensis holorodicca, which is a type B, but it's found in Europe and Asia, and it causes milder diseases. Francisella tularensis is a small, non-motile, gram-negative Coccobacillus. It is a non-spore forming, aerobic, and facultatively intercellular, meaning it can live inside or outside host cells. It has a thin cell wall, typically of a gram-negative bacteria. The bacterium is fastidiosus in growth and requires cytine-enriched media to growth in the laboratory. On to our next slide is cat scratch fever, which is also known as CSD, short for cat scratch disease. This disease is also a bacterial infection. It is caused by Bartonella henselae, which is transmitted from cats to humans through scratches, bites, and also saliva. Bartonella henselae belongs to the family Bartonellaceae. Domestic cats are the main reservoir for this bacterium. Infections typically occurs after a cat scratches or bites, which introduces the pathogen into our skin. Cats usually carry the bacterium without showing any symptoms. Bartonella henselae is a phylomorphic gram-negative bacillus that can appear as short rods or curved shapes under a microscope. It is an intercellular, living inside an endothelial cell and red blood cells. The bacterium shows that it slowly grows in the culture. On our next slide, I will be talking about the spread of each agent. Tularemia can be transmitted to humans in multiple ways. Common modes of transmission include bites from infected ticks and deer flies, which is shown on the slide, handling infected wild animal carcasses, especially rabbits or rodents, inhaling contaminated dust or aerosols, laboratory exposure, and also drinking or eating contaminated food or water. This disease is not spread from person to person. It's spread from direct contact with infected animals or orthopoxic vectors is a primary cause of this disease. Cat scratch fever is spread when humans are scratched or bitten by infected cats, exposed to infected cat saliva or flea feces, through open skin or the eyes. Cats acquire B. henselae through flea bites, flea dirt that enters scratches during grooming, but by controlling fleas in cats is important for preventing the disease. Cats often become infected through the cat flea. Many infected cats remain asymptomatic carriers. Moving on from the pathogen descriptions, I will be talking about the signs and symptoms of the infections. The symptoms of tularemia vary depending on the mode of infection. The most common symptoms are causes a skin ulcer at the infection site, swollen lobe nodes near the infected area, fever, chills, headache, and fatigue. The symptoms caused by inhalation is coughing, chest pain, shortness of breath, and can potentially lead into pneumonia. The orphangeal tularemia symptoms are sore throat and mouth ulcers. The last symptom is typhoidal tularemia, generalized fever and symptomatic infection. The symptoms of cat scratch fever usually appear 1 to 3 weeks after a cat scratch or bite. The initial symptoms are a small bump or blister forms at the wound site. Another symptom is followed by tender lymph node swelling near the affected area. Other possible symptoms are mild fever, fatigue, headache, poor appetite, and the rare complications are eye infection, encephalopathy, which is brain inflammation, and lastly, liver and spleen lesions. In my last slide, I will be talking about how each infection will progress if left untreated. Untreated tularemia can lead to severe complications including sepsis, pneumonia, and organ failure. These complications are more likely with virulent stains or inhalational exposure. The mortality rates may reach 5 to 15% without treatment. Moving on to the next infection is cat scratch fever. Most healthy individuals recover spontaneously within several weeks or months. When the cat scratch fever is left untreated, the lymph node swelling can persist for extended periods of time. The infection may spread to the organs, leading to more serious complications, such as bacillary angiomatosis, and lastly, hepatic lesions.
Treatment and prevention. Tularemia requires prompt antibiotic therapy. The preferred treatment for severe cases is gentamicin or streptomycin, while doxycycline or ciprofloxacin may be used for milder cases or step-down therapy. In cases of laboratory exposures, post-exposure prophylaxis with doxycycline 100 milligrams twice daily for 10 to 14 days is recommended. For cat scratch fever, mild cases often resolve without antibiotics. However, azithromycin is commonly prescribed to speed up recovery. In severe or systemic infections, doxycycline, rifampicin, or gentamicin may be used for several weeks, depending on the patient's condition. Some symptom relief that can be used are pain relievers, such as acetaminophen or ibuprofen, and warm compresses. Preventative measures. Preventing tularemia involves using insect repellents, wearing gloves when handling wild animals, avoiding lawn mowing over dead animals, and cooking animal meat thoroughly. There is currently no licensed human vaccine for tularemia. Live attenuated vaccines were used on high-risk laboratory workers and military personnel, but it was not licensed for general public use in the United States. For cat scratch fever prevention, individuals should avoid rough play with cats, wash scratches immediately, control fleas on pets, and keep cats indoors. Immunocompromised individuals are advised to avoid young kittens because they are not likely to carry B. henselae. No vaccine currently exists for this bacterium. Epidemiology of the infections. Tularemia is rare in the United States. From 2011 to 2022, 2,462 cases were reported at an average of 205 cases per year, with an incidence rate of approximately 0.064 per 100,000 people. This represents an increase of roughly 56% compared to the cases reported in 2001 to 2010, which was 1,208 cases. This may be due to an improved detection of the disease and recent outdoor exposure trends. Cat scratch fever, on the other hand, is more common with about 4.5 cases per every 100,000 people in the United States. The exact number of cases can't be found, but the estimated The estimated cases in 2011 to 2022 is 242,000, and 2001 to 2010 is 220,000, averaging at 22,000 cases per year. This disease has remained relatively stable over time, showing consistent cat ownership and fleet exposure rates. Tularemia occurs in most of the states in the United States, but it is most common in the South Central and Pacific Northwest regions, especially in Arkansas, Missouri, and Oklahoma. It is most common in these places due to their large population of wild animals, the high number of ticks and deer flies, and the high number of people who partake in outdoor activities such as hunting and fishing. It affects people who typically spend a lot of time outdoors, particularly landscapers and hunters, and it is more frequent among males and children between the ages 5 to 9 because children are more likely to play outdoors. Cat scratch fever is found worldwide, but it is more frequent in warm, humid areas where fleas thrive, such as Florida, Texas, Louisiana, Georgia, Oklahoma, North and South Carolina. In the United States, cases occur most often in southern states, and in children ages 5 through 14 are most likely to contract this disease because they are more playful with cats. Immunocompromised individuals are prone to severe cases. A local outbreak of pneumonic tularemia occurred on Martha's Vineyard, Massachusetts, where landscapers were exposed to aerosols from mowing over infected rabbits. 7 individuals were infected, and several of them required hospitalization. The outbreak was traced to inhalation of Francisella tularensis particles. A community cluster of cat scratch fever was reported among children exposed to kittens from the same litter. Several children developed a fever and their lymph nodes began to swell. They were successfully treated with azithromycin and supportive care.
Some interesting facts about Tulmeria is that it has an extremely low infection dose, meaning that fewer than 10 bacterial cells can cause infection, which makes it one of the most infectious bacteria known. This is the reason it is classified as a tier 1 select agent for bioterrorism concern. Interesting facts about cat scratch fever is that it's about 1 in 3 healthy cats, especially kittens, carry the bacterium in their blood without appearing sick, so they serve as silent carriers of human infection. Questions for the audience. How can cat scratch fever be prevented? How can we prevent animals from getting the infection? How does a person's immune system affect the course of the disease? Why is Tulmeria often mixed up with other diseases? And how can we diagnose it early? And these are our references.